have a story to share. My son Zarif is very active. Every day he runs, jumps, and moves around. But one day, he fell from a pavilion. I was extremely terrified. The doctor confirmed that my son's hand was broken. So the doctor inserted three metals implant with 10 centimeter long into his elbow. These three rods were protruding from his hand. I was shocked. Doctors said that the healing process took up to 3 months. He has been skipping school and I need to take 3 months leave to look after him. The most devastating part was after 3 months of rehabilitation, Doctor pulled out the roots using his bare arms, while Zarif was consciously sitting on a chair without getting ingested any sedation. I bet all of you can guess how loud Zarif screamed that moment. Ladies and gentlemen, we are talking about the bone implant. These conventional implants have an intact structure that is a bit difficult to integrate with cells, so it takes longer time to cure. It was easily corroded that need to be removed after a few months or maybe years, which means that a fractured patient needs to undergo surgery twice. Can't you guys imagine how painful it feels? This heartbreaking tragedy has inspired me. Hydroxyapatite-Incorporated Silica Aerogel Nanoparticles, the resorbable bone implant, was invented. So today, I would like to share the resorbability properties of this material through this research project entitled In Vitro Cell Migration Analysis of Hydroxyapatite-Incorporated Silica Aerogel Nanoparticles. These are our team who are first, I myself, Suriani, Senior Research Officer of Institute of Human-Centered Engineering, iHuman. My main research product are silica aerogel derived from soil gel techniques that used to immobilize biomolecules and herbs, biomaterials for soft and hard tissues application. Second is Associate Prof. Technologist Chemist Dr. Ni Ahmad Nizam. His expertise is in applied material science. And third is Dr. Khairul Nadwa, who is immunologist and expert in cell tissue culture. Right. Lack of tissues and organs that are available for transplantation, as well as problems associated with transplantation, such as disease transmission, immune rejection, and expensive storage, lead to the emergence of hydroxyapatite as an alternative biomaterial. Hydroxyapatite has been widely used in bone and tissue grafting. It also has been used as a filler for treating wrinkles and skin rejuvenation. It is due to its composition, which is similar to human bone. So it is biocompatible, osteoconductive, and bioactive. However, its medical application has limitation. Several studies reveal that needle light and micro-rod hydroxyapatite inhibit cell growth compared to spherical hydroxyapatite. Micro-rod hydroxyapatite exhibit higher degree of dissolution. Therefore, the cells consume high dosage of essential ion. So it triggers apoptosis signal in cells. So to overcome this problem, hydroxyapatite was normally modified with silica-based material. However, silica is not simply added to hydroxyapatite like this. In addition, conventional silica aerogel is also very expensive. It requires high temperatures, high pressure condition while preparing it. So in order to address these problems, Hydroxyapatite-Incorporated Silica Aerogel Nanoparticles, or its catchy name HASA-MP, was invented. The description and benefit of HASA-MP can be found in our article entitled Overview of Hybrid Silica Aerogel as Biomaterial. So, happy reading. Well, this is the essence of my presentation today. The resorbability properties of these materials, the effect of the sample extract, migration, and healing ability of normal human fibroblast cell, which is skin cells, were further studied using cell migration assay. This HASA-NP will go through two types of studies. Okay, in the first assessment, the media cell was treated with HASA-NP, hydroxyapatite, and silica aerogel for 7 days for comparison. Then the resorbability pattern of HASA-NP was further analyzed by treated with HASA-NP at 3 different days, which are 2, 5, and 7 days. Then the ability of the cell to heal and to migrate was monitored within 24 hours of scratching. The migration of cells was microscopically photographed and analyzed using image J. These are the images of the fibroblast cell migration after 24 hours scratching. The stretched cells were exposed to untreated media and media that were treated with silica aerogel, HASA-MP, and hydroxyapatite at 7 days. So images show that the cell migration was highly stimulated by HASA-MP compared to silica aerogel and hydroxyapatite. This graph shows that silicic acid was released from silica aerogel and HASA-MP, but there was no silicic acid detected in the media that was treated with hydroxyapatite. This graph also shows that the high dissolution of silica aerogel leads to the rupture of silica aerogel network, thus inhibit the addition and proliferation of cell. Thus, these results summarize that an optimum amount of silica plays an important role in stimulating cells growth. This graph shows that hydroxyapatite released high amount of phosphate ion, which eventually affecting the cell growth and slightly inhibit the proliferation of cells. It also demonstrates that the high release of phosphate from microroid hydroxyapatite and the high release of silicic acid from silica aerogel were delayed by covering hydroxyapatite with silica aerogel networks, which eventually enhanced the biocompatibility and biofunctionality of this HASA-NP. Again, these images show that cell migration was clearly stimulated by HASA-NP. Cell migration increased with the increasing treated time. The closure area was the highest when media was treated with HASA-NP treated 7 days. This graph demonstrates the percentage of silicic acid loss increases with the increasing days of treatment. It confirmed that the proliferative response depends on the concentration of silica, which implies that the proliferate cells consume the silicic acid release. This result also validate that the incorporation process enhance the stability of silica aerogel networks in HASA-NP. This material can initially stimulate cell growth, followed by a switchable supply of phosphate ion from the incorporated hydroxyapatite of HASA-NP, which finally enhancing cell differentiation and tissue formation. So all these findings highlight the main application of HASA-NP. Zooming into its micron structure, HASA-NP is just like a Ferrero Rocher. At the heart of this yummy chocolate is a whole smooth surface of white-colored brittle hydroxyapatite. The nanospherical silica aerogels cover up this hydroxyapatite. Like a bar of milky chocolate, silica aerogel easily dissolve in a body and stimulate cells growth, while the incorporated hydroxyapatite facilitates cell migration and promotes cell addition. The ability of HASA-NP to enhance fibroblastic growth and its capability to stimulate cell migration verify that HASA-NP is resolved and can be used as a wound healing agent or possibly for the resorbable implant. However, further evaluation and future work might be needed before HASA-NP can be widely applied in the medical area. So, with HASA-NP, there will be no secondary surgery, no root protrudes out of your body, and no 3 months unpaid leave. I hope the resorbable biomaterial could help thousands of people. The broken bone can be managed painlessly. So next time, when you come across with someone who has a bone fracture, remember Hasa NP, remember our team, remember me, Suriani, a researcher of iHuman, ChM. Thank you. Alhamdulillah, thank you.